We are starting the webinar. Good afternoon, everyone. Thank you so much for accepting our invitation and joining us for today's webinar on neurodevelopment of feeding. On behalf of Anshu Center, I am Ms. Anshu Budhani, a behavioral therapist and a clinical psychologist, would like to warmly welcome you all. I'm sure today's session is going to be insightful and informative for everyone joining us. At Anshu Center, we are excited to begin a series of insightful webinars and discussions every Saturday, led by therapists from various domains. These sessions are specially designed to help parents and caregivers better understand their child's developmental needs and support them more effectively. Let me tell you a bit about Anshu. Anshu is an adult and child developmental center and an urban extension of Kasturba Health Medical Research Center, Ward. Anshu is located at Vithika West, Mumbai. We provide early intervention services to children with neurodevelopmental delays, sensory processing difficulties, learning disabilities, autism, and children requiring emotional and behavioral support. We cater to all age groups from infants to geriatrics. Team Anshu comprises professional qualified and occupational therapists, physiotherapists, speech therapists, clinical psychologists, nutritionists, special educators, and more. Here at Anshu, we provide various services, including adult and pediatric physiotherapy, occupational therapy, speech therapy, feeding therapy, counseling, mental health care, behavior therapy, special education services, and more. Anshu strongly believes in building a strong community where people are healthy, supported, and empowered. Our vision has always been to excel in service, expand in love, and advance in knowledge. Now, it is my pleasure to introduce our speaker for today's session, Dr. Vithika Rai. She is a qualified physiotherapist and a feeding therapist at Anshu Center. Dr. Vithika is known for her compassionate approach, clinical expertise, and dedication towards supporting children and their families in their developmental journey. Today's session will include an engaging presentation following a question and answer segment where participants can ask their question and interact with the speaker. We request everyone to kindly keep themselves on mute during the session for smooth contact. You may also drop your questions in the chat box and we will take them up at the end of the session. In case the Zoom meeting ends, it will still, and if you still have some queries, you can join on the same link. We will be available for 15 minutes post the session. Now, without further any delay, let us warmly welcome Dr. Vithika Rai and hand over the session to her. Thank you and wishing everyone a meaningful and enriching session ahead. Dr. Vithika Rai, you can take the lead.
Thank you, Aisha, for that lovely introduction. Good afternoon, everyone. We'll be starting with the presentation now. I think feeding is a very important topic for every parent and every professional these days. Like getting a child to eat is one of the most difficult things, and also the first way of connecting with your child. So, let me just put on the presentation. So we are discussing neurodevelopment of feeding today, which is we are going to see a gist of the feeding disorders we have and how the treatment and which professional you need to go to. While the most of our presentation would be about normal feeding and how and when a child eats. So there is a big gap in the information. We have seen a lot of ads that the government has run where the child is supposed to be on exclusive breastfeeding for the first 6 months of life. But post that, to integrate the child into family meals, there is no guidance on it. There is definitely an inflow of information on Google and AI these days, but the information overload is so much that it's not really showing results. So let's just get an idea of how to feed our little ones. So um, Just give me 1 second. So, what is feeding? Feeding basically means how a child takes in food and drink from sucking as a baby to chewing solid food. It's not just about nutrition, but about bonding, learning, and growing as well. So, when it is food, like before a child starts to eat, everything a child does by himself. They play by themselves. They are interacting with the environment, but feeding is the first place where they can actually bond with the family and have a common experience. So it's not just important for their oromotor development, but also for their overall social development. How common are feeding problems? These days, every 1 in 4 children who are developing normally have some or the other feeding difficulty at some point. Up to 80% of children with developmental disabilities also have feeding problems. And definitely, we are all aware that feeding problems affect the whole family and not just the child. Like if a child is unable to eat, it also hampers the parents' social life. It hampers the mental peace of the parents themselves. We Indians as a community love feeding people. So if you're unable to feed your own child, that definitely takes a toll on your mental health as well. So why does it matter? If a child cannot eat well, they may not grow properly or reach developmental milestones. It can cause stress and worry for the parents and caregivers, and early help makes a big difference in the child. So we'll see that further why approaching a qualified person earlier helps. So knowing that there is a feeding problem is important so that you can approach the correct people. So the early childhood, like today if we see all of us, we are not going to grow or learn a tremendous amount of information in 1 year. But when you see a baby, the first year of their life, they learn the most. They have to learn to walk, to crawl, to babble. They have to learn every milestone that they have to achieve in 1 year, alongside growing in their height, their weight, and growing all their body parts. So this early phase is very important. In this phase, if the child's nutrition is not correctly managed, that can create a lot of growth delays. So adequate intake of energy and macronutrients is very important. They're a prerequisite for achieving physical growth and potential for good neurocognitive development. On the other hand, early childhood development of eating and swallowing is a sensitive process as well. So if you don't expose the child enough, the child is not going to learn to eat. At the same time, if you end up force feeding the child, again the child is going to reject food in the future. For adequate development of eating skills, certain neurodevelopmental steps are required, which are achieved in a sequential manner. Like the child is not directly going to eat solid food, we are all aware of that. So we'll just go through all the different types of things the child has to go through to reach a level where they eat family foods. So the neurodevelopmental basis of feeding. So just I'll give it briefly. The feeding is not controlled by the mouth or the hand like we think. It is controlled by the brain and the brain stem. So the brain stem is the जिसको हम छोटा दिमाग बोलते हैं. So under the brain there is a smaller structure that is called the brain stem. It consists of 3 parts. So from there your central pattern generators come, which control the sucking, chewing, and swallowing. So when we are born, everything is reflexive. You are not, uh, you know, you're not eating or kicking or holding something by choice. वो reflex से हो रहा है. Like if you, for example, give a finger in a baby's palm, they are going to hold it. If you touch their feet, they are going to withdraw it. So it's all reflexive. It's not happening like today. If I touch a finger to your palm, you have the option of closing it, taking it away. You'll do whatever you want to do, but a baby by reflex will only grab it. So they have these reflexes to protect themselves. Similarly, sucking, chewing, and swallowing is automatic at birth. If a child is born at a normal gestational age, like 36 weeks के बाद अगर बच्चा पैदा हुआ है, they have these things already in them. and it is automatic. So that is why they have these reflexes. So only they can have milk at birth, because they cannot really, chew with a lot of strength. So sucking and swallowing is majorly the only reflex they have, and these work automatically. Slowly over the course of 1 year, they have to go from these automatic feeding to actually chewing, biting, and eating out of their own voluntary control. Like they should want to eat, only then they'll be able to eat. So this whole process is a big transition for a child. And the baby's body and the brain must be ready. What do we mean by body and the brain? So the baby's mouth, throat, and larynx, the throat area is structured differently than an adult. It's much smaller. The angulations are different. So they cannot directly have regular food. As they grow, these structures change. And alongside that, good posture, good muscle tone, awareness of your body, that when I'm feeling hunger, when I'm feeling full, all of this awareness helps the baby to learn how to eat. This is your basic, gist of how feeding goes. So your brain needs to slowly understand when to eat, what to eat, as well as your body needs to know how to sit, how to chew, how to understand the cues of the body. Let's look at this chart. We have all heard कि पहले 6 महीने में बच्चे को सिर्फ माँ का दूध पीना चाहिए. So why is that? That is because they only have the reflex, like I told you, कि वो खुद से नहीं उनको पता है कि उनको क्या खाना है. उनको reflex से पता है कि if the nipple touches the baby's face, they'll turn to that side. That's how they find where they have to, get the milk from. Because again, their vision is not that developed, their hearing is not that developed. So the seeking reflex that tells them where to, get the milk from. The sucking reflex that voluntarily starts if you put a tiny finger in a baby's mouth, they automatically start sucking. So that reflex tells them how to suck. And the swallowing is also reflexive once the milk reaches the end of their throat. Socially, why this is important? Because when a child is born, they still feel like they're a part of the mother. Slowly through the breastfeeding process, the debonding of the mother child dyad happens, and the child slowly understands that I am an individual by myself. Physiologically, their digestive system, their stomach, their intestines are not well developed to absorb anything else, not even water. So that's why they have to be exclusively on breastfeeding for the first 6 months. Anything else we give is directly excreted out, and extra water can increase their the amount of blood in their body. It can dilute the amount of blood in their body. That's why we don't give them water. From here, after the 5.5 or 6 months, they have to slowly go into eating the purees. So oral movement, spoon feeding, appetite, refusal, all of this comes in after 6 months of age. So they can chew better, they can take a spoon, their jaw is getting stronger, by which they can hold the spoon. They understand when they are hungry. So overfeeding is another problem we see a lot in our community, because we feel that our kid should eat this much, but we don't look at their cues. Like if they're stopping like after 75% of the portion, why are they stopping? Why are they not continuing to eat? So maybe the child is full, so you should stop at that time. Again, you'll pick up the cue when you see the child is crying, oh, that there is hunger. But if we keep overfeeding them or underfeeding them, they're not going to understand the hunger and satisfaction, and they'll never come up to you themselves to ask for food. So you need to understand and pick up the cues of the child. So refusal also comes in at this age, where the child will not readily take all foods, they'll refuse food. And why we are starting with purees majorly is because by 6th month their head control is complete, so they can sit upright and their neck posture is correct, so they're ready for semi solid or pureed food. Then individuation. By now the child has figured it out that I'm a different individual, I'm not just an attachment to the mother. And there is increased need for energy and nutrients, because now the child will start rolling, they will start crawling, so unko energy bhi zyada chahiye for all of this. Then there is a transition phase, which is the most difficult transition, to go from pureed food to solid food. So this happens when the child learns to sit by themselves, unsupported. Puree you can give when they sit with support, when their head is upright. But for solid food, you need them to sit unsupported, because then they can use their hands to use a spoon, to take finger foods, to play with food, to explore food. So now their hands are free because they can sit without support. So they're ready to, pick up solid. This is the time when you would introduce boiled vegetables, finger foods, carrot sticks, all of these things which they can pick up. Maybe they can play with the different textures of food so that they're comfortable with all of that. From there, now tooth development will start happening. They'll drink from a cup, because again they can use their hands to drink from a cup. They can pick up, they can use their fingers, they can sit automatically. This will help them integrate with the society. Social integration will come in, because they can sit at a table with the family, they can sit on a high chair, and they can be a part of the meal. And that is the first sort of social interaction a child has in the family. So that's very important for their social development as well. And towards the end of 1 year, they should be integrated into family food. So if you are having dal khichdi or you are having roti, make it a little softer for them. Maybe put more ghee, but they can start having that by the end of 1 year. After that, their milestones are chewing different types of food, exploring different types of food, using a fork, using a spoon. All this will come eventually. By 3 years, they should be able to do everything that we can do. So this is the same thing. Just another thing is that in the womb, when the baby is in the womb at 13 weeks, their swallowing is initiated, and they can suck on fingers by 15 weeks of being in the womb, not outside. So active sucking is ready only by 34 to 37 weeks. So babies who are premature,
कौन सा?
they usually do
हाँ
not
मैं तो
have
बाहर
the
से आ जाऊँ.
sucking reflex. So they need more training for the oromotor stimulation. The other things we have already discussed. So now what are the sensory and motor components of feeding? So feeding is not just, you have given the food and the child has eaten it. There are different steps. So the first step is pre-oral. So before even eating, the child is just seeing the food. They have to be comfortable with seeing the food. They have to smell the food. They have to feel hunger. Only then they'll open their mouth to have the food. That's your pre-oral phase, before the food has gone into your mouth. The second phase is the oral phase, where the food is being chewed and moved around the mouth to form a ball. The third phase is pharyngeal phase, where the food is swallowed by the baby, and the airway has to close so that your food is not going into your windpipe. Your step 4 is the esophageal phase, where the food is going into the stomach. These four things have to be okay. Most of our kids struggle with phase 1 itself. They're not comfortable with how the
मैं
food
मिली
looks.
नहाने
Uh,
गई क्या?
they're not comfortable with how the food looks. They're not comfortable with how the texture of the food feels, the smell of the food. And like I said, if the overfeeding and all has happened, then they don't understand hunger as well. The chewing is the second stage, where they face an issue. If their oromotor structures are not well developed, or they're not strong enough, then they cannot chew and bite. And swallowing, again, if the child cannot chew, they have a history of gagging or throwing up the food, where they have a fear and then they are afraid to swallow the food. um, so what do these sensory skills help with? So touch and pressure. Touch and pressure helps you with sealing your lips on the spoon, or your tongue movements help you move the food. You are more comfortable picking up the food. Jaw control is needed for the biting and chewing. Posture balance is needed, because unless you're stable enough to sit, you cannot focus on doing anything else. So your posture and balance matters a lot. Body awareness, where you yourself feel when you're hungry, when you're full. All of these senses help you in your feeding. If any of these skills are weak, feeding will be harder for the child. So you can go to a proper professional, a speech and language pathologist, or an otist, or a physiotherapist. They'll evaluate these things for you. Your pediatrician can evaluate, your ENT can evaluate, and they can let you know that if this child needs feeding therapy. The red flags, when can you go to the professionals? So if your child cannot suck well or keeps falling off the breast, that's in the initial part. lot of drooling or food falling out of the mouth, cannot move from soft pureed food by 12 months of age, like they've not started solid food by 12 months. That is when you should check in with your pediatrician if any intervention is needed. Safety concerns, like if the child coughs or gags or chokes often during every meal, that means the food is going in their airway and not in their food pipe. Noisy or wet breathing after feeds, repeated chest infections, all of this are the signs where you should seek help. Developmental concerns, that like if there is a feeding issue post 3, then it could be a wider sensory issue. You should even developmental delays, you should get it checked again. Behavioral and emotional concerns, if they eat very less, or if the parent is getting anxious, the child is getting anxious, you are having to force feed every meal, then again you should get help. If you notice these, getting an early assessment is always good, because the more a child develops the opinions, preferences, the harder it is to break those learned patterns, unlearn and then learn. If a child comes in early, you just have to teach them and they'll learn it in one go. It's always easier the younger the child is. So, first we'll watch this video. This is a child who came to us when he was 2.5, 3 years old, between that age group, and the child wasn't even comfortable with the food being in the room, not even the table, but the food being in the room. He was uncomfortable with the smell, with the taste. So, slowly you'll see in this video how he has progressed and where he has reached. First, we'll just watch it. So like we could see in the video, what we started with was just keeping the food in the room open, and then we were just making the child play. We were not talking about food, not giving food, and anywhere in the video, anywhere in our sessions, nowhere we force feed the child or even feed the child. We only want the child to pick up and eat by themselves. We are not feeding them at any point. So firstly, the child just has to play or do his activities with the food in the room. Second thing is, we as therapists would sit around and bring the food on the table, and the child also has to be there, doesn't need to interact with food, just be there. The third thing is, the child has to pick up the food and smell it and lick it if the child is comfortable. So that's what we saw the child doing. uh, I'm just playing it in the background. So the child was just like smelling different things and licking it and being comfortable with the touch of food and manipulating the food in the hands first. The fifth step is being comfortable with tasting the food. That is picking it up, taking it to your mouth. So you saw the child do that with the guava, with the roti, with the carrot sticks, but the child was still not biting or chewing it. In towards the end of the video, we can see that the child learned how to bite and chew the food, but he still didn't learn, how to manipulate it with the tongue. So that part was still left, and like he's still learning. It's a process. And the last step would be swallowing the food. So this is how the therapy also works. We do different things for it to develop the strength, to get them comfortable with the textures, and then go ahead from there. What's the biggest role in feeding therapy belongs to the parents and the environment, because the child may be with us for one meal, but you get 3 or 4 meals every day with the child. It's a two-way relationship. So the parents can watch for the hunger and fullness cues and respond to them. Never force feed the child, because the child will develop more, fear from the food. The parents can decide what food and when, and the child has to decide how much. So it is a two-way street. And always give the child two options, so it's easier for them. They feel that it's their choice. A calm and consistent routine. So a lot of times we have seen that, the parent starts the therapy and follows what we do, but then they try one thing one day and they give up. So you have to stick to it for at least a week or 10 days, offer it to the child, and then do the same thing for 10 days. If they still reject it, then move on to the next thing after that. So why the environment matters? They have to be given new food without pressure again and again. It's the best way to build acceptance. Reduce the distraction, so no screen, more family time, so that they are actually, seeing what they're doing and eating, and not just distract feeding them. Good seating and right equipment, so no sharp spoons or sharp utensils which will hurt them, and they'll develop that behavior कि ये इससे मुझे दुख रहा है तो फिर मैं ये नहीं खा सकता हूँ. So the proper things have to be used, a proper high chair where their knee, everything, the height has to be proper, they're sitting upright. The parental well-being, so it is very normal to get stressed if your child is not eating, and when the pediatrician is telling you the weight gain is not okay. So it's normal to feel stressed, but that has to be kept a little out of the picture when you're sitting with your child, because the child can always sense that stress. So that has to be a thing that the parents have to do on their end. And we as therapists also talk to parents, we guide them on what to do, and always, asking more questions and doubts will help you out. So, the take home message from this presentation is that feeding is one of the most complex things a young child learns to do. It starts in the womb and develops step by step through early childhood. The brain, muscles, senses, and emotions all work together for feeding to go well. Swallowing happens in 4 stages, like we saw. So, spotting these problems early leads to better outcomes. Therapy follows the child's developmental level. Like, just because a child has come to us at 3 doesn't mean we'll directly start feeding them. Even then, we have to go through the whole process. And wherever they are developmentally, if they are at a stage where they're only okay with the food on the table, we have to start from there. Then parents and the home environment are keys to success. Support the family, not just the child. A team approach works best. So, just a final thing, the team would involve everyone from a pediatrician, speech language pathologist, occupational therapist, physiotherapist, dietitian, and a child psychologist. Sometimes when the child is older, just these things won't help. You need to talk it out, understand why the child is not eating. So a child psychologist is also a part of the team. So yeah, so one plan is needed so that the, family can focus on the child. So I will hand it over to Aisha again now, who can start with the question answer sessions if anyone has doubts. And just note that the meeting might end in 5 minutes. So in case it does, you can join again on the same link. We'll be available for 15 more minutes. Thank you.
Thank you so much, Dr. Vithika. It was a really insightful and informative session. Your guidance and expertise truly helped us and understand the importance of neurodevelopment feeding and the various ways we can better and support children in their development journey. I ask if anyone of has any questions, they can ask directly to Dr. Vithika, or they can put up in the chat box and it will be answered.
Hi, Suvarna. You can ask us the doubt you have.
Yeah. Hi, Dr. Vithika. So first of all, thank you for the very insightful presentation. I just had one concern. So my child will be turning 3 months in a week now. So,
Okay.
so from like last 3 to 4 days, I have noticed that he has started putting his both the hands into the mouth, like even if he's full, even after feeding, or he has started sucking his thumb while sleeping. So, is that a matter of concern? Should I, consult a doctor or anything for that? Or and second thing is, will pacifier giving pacifier work for that? Like, I just have a concern about that.
So it's a very valid doubt. So thank you for bringing it up. So at his age, it is definitely okay for him to, put his hands in his mouth because that's his sensory need, firstly. Secondly, it is
Mm-hmm.
also because he's trying to explore. So they're trying to see what is around and learn from it. So that is okay. And another very important thing is not to react very emotionally or with loud voices when they do that, because if you stop the hand to mouth now, they'll also not develop it for feeding further because they don't know when to put the hand in the mouth and when not to. So you can see definitely there is a hygiene concern, so you just have to keep their hands clean and all their toys clean. It's completely fine if they're putting things in the mouth, and you can always distract them or do something else so that they stop doing that. But forcefully taking it out of their mouth would just in the future convince them whether to like confuse them whether to put food also in the mouth or not, because they'll remember, oh, mama shouted when I put my hand in my mouth or my toy in my mouth, so should I put things now? Secondly, pacifiers, but the correct ones. So, of course, you can reach out to us later and we can guide you, but the correct pacifiers can be given. Not all pacifiers are okay. They also depend on your child's developmental level, and then, those pacifiers are okay for the child.
Yeah, okay, sure. Thank you.
Welcome. Anyone else? Any doubts? Okay, so Aisha, we can just
If
wait
you
for
have a
another.
doubt, yeah, we are waiting for another 15 minutes. But let me mention, if you have any doubts, you can reach out us to later also for any guidance or any support to it.
Yeah, so in the chat box, we are just putting in our clinic number so people can note it down. Any doubt or any guidance you need, you can just, reach out to us later. So you can just note down the number and you can call us up or reach out to us whenever needed. Aisha, you can, I think, uh, give a vote of thanks and we
I,
can close the meeting.
uh, Once again, thank you so much, Dr. Vithika, for such a great session. It was a very informative way. We simply explained such a complicated task that parents are facing right now. Thank you for that. We also extend our heartfelt thanks to the parents, professionals, and participants who joined us today and made this session interactive and meaningful through your presence and questioning. We all hope today's webinar gave you a valuable insight and practical understanding that you can take forward in supporting your child more effectively. As mentioned earlier, Anshu Center will continue hosting informative webinars and discussions every Saturday with therapists from different domains to spread awareness, guidance, and support for parents and caregivers. Thank you once again for being a part of today's session. We look forward to seeing you in our upcoming webinars. Have a wonderful day ahead and stay safe.
Thank you so much. Thank you, everybody.
Thank you.